In this vignette, we're going to talk about drug reconstitution. We're going to go over the 5 rights. So we'll include drug selection, how do you organize your drugs, appropriate labeling, and dosing. So again, even though we're in anesthesia, we still want to make sure that we have the 5 rights, that we have the right patient, the right drug, the right route, the right time, and the right dose. Drug selection is going to be based on the type of anesthetic that you are providing. Irrespective of the type of anesthetic you're providing, you always must prepare as though the case may proceed to a general anesthetic. So in organizing ourselves, we like to sort of have a 3-pronged approach to this. We want to make sure that we have an order that is consistent, that we do every single time, which thereby helps us minimize mistakes in administering the wrong drug. We also want to make sure that we have the appropriate labels on our drugs, and we also want to make sure that we have a standardized concentration of our drugs. That can vary institutional, so you need to be aware of the drugs that are available and the standardized concentrations available for your particular practice setting. When we talk about labeling, labeling is color-coded. Induction agents are yellow. Local anesthetics are labeled as gray. Muscle relaxants are labeled as red. Why? Being because obviously you can paralyze a patient and render them unable to breathe. The difference between these two are the black label on our depolarizing muscle relaxant. This is our non-depolarizing muscle relaxants that just have the plain red. Blue labels are opiates. Orange labels are anxiolytics or tranquilizers, and green are anticholinergics. So when we talk about standardized concentration, there are appropriate standards for each drug. For example, Diprivan is available 10 milligrams per cc. Our opioids of choice, fentanyl, is 50 mics per cc. Midazolam varies from practice setting to practice setting. It's available 1 milligram per cc, 5 milligrams per cc, and 10 milligrams per cc. So you do need to read the label and be very, very clear as to what you're administering. Glycopyrrolate is 0.2 milligrams per cc. Our emergency drugs, we have ephedrine and neosynephrine. Ephedrine is available in a 50 milligram vial or ampule. We dilute that to 5 milligrams per cc. Neosynephrine is available as 10 milligrams per cc, which makes it a 1% solution. We dilute that to 100 mics per cc. Succinylcholine is available as a standardized concentration of 20 milligrams per cc. Now, in organizing our syringes, you'll find that as many practitioners you find, they will organize their setup differently. The way that I do it is I work from outside to in, with my first syringe on the outside being my glycopyrrolate, and then next my midazolam, because I will take those to the recovery room with me. As I come in the room, I'm going to want to give an opioid, then I'm going to give these 3 as my induction, my lidocaine, my propofol, and then my muscle relaxant. My rescue drugs are in the back, my vasopressors, which are labeled purple, and then I have in the very back my succinylcholine as my rescue drug. So in this vignette, we've gone over drug reconstitution, we've gone over the medication safety module, the 5 rights, appropriate drug selection, organization, labeling, and dosing.